So NCLEX test item writers seem to like lithium. They like to talk about that level that we just went over, and they like to talk about this fluid balance. NSAIDs like Motrin and Celebrex, concurrently used, will increase the renal reabsorption of the lithium, leading to toxicity also. So we encourage them to avoid these, or just make sure you get the whole medication list, of course. On page 181 are our listings for the maintenance level, which they say in this second bullet is 0.4 to 1.0 milliequivalents per liter. Also, on page 186, it will say that your maintenance range is 0.4 to 1.3. So even in their literature, they don't have it all the same. But greater than 1.5, toxic. So that's why I was thinking 2.0 on your lithium level, bad and going to get worse. And again, they mentioned hemodialysis might be the only thing you could do to help with toxicity. And again, this is a narrow therapeutic window. A lot of drugs we take, we never test our levels. We did digoxin levels in a few things, Depakote, probably more in the psychotropic medicines than any other kind of medicines. But still, you would need to watch for the signs and symptoms and correlate it with the lab values. Usually it says on the fourth bullet down that lithium is prescribed in 2 or 3 doses daily due to its short half-life, so the body's using it up quickly. Whereas something like Valium that we studied in the first chapters, that takes forever to get out of your system, causing respiratory depression and sleepiness. But lithium is going out of their system really fast. And taking it with food can help the GI distress. Adhere to laboratory appointments, or of course make sure you're reviewing the laboratory results if you are the nurse in charge. Provide nutritional counseling because they have to have adequate fluid and sodium intake. So maybe that helps to make that all make sense. Again, be sure and read in chapter 5 in your textbook about lithium and sodium. Our next classification is the mood-stabilizing anti-epileptic drugs. It really surprises me how many of these are used in mental health, especially in children. The Tegretol, the Depakote, and the Lamictal. The Depakote was used very frequently at Johnson County Care Center in pretty high doses. It seemed to help the mania, their psychosis, just the acting out type of behavior. And Depakote is also another one of those drugs where there will be testing their levels. It says expected pharmacological action. AEDs help treat and manage bipolar disorder through various mechanisms, which include slowing the entrance of sodium and calcium back into the neuron, thus extending the time it takes for the nerves to return to its active state. So that may be a little bit complicated to wrap your mind around, but read those over several times and help you understand how those are working for the mentally ill along with epileptics. On page 182, we have the side effects listing here for Tegretol, very commonly prescribed anti-seizure medication for behavior problems. Let's see, it has minimal effects on the cognitive function, blood dyscrasias like leukopenia, anemia, thrombocytopenia, teratogenesis, so of course women who might be pregnant need to avoid it. And then the last one, skin disorders, you look for dermatitis. It could even cause that Stevens-Johnson syndrome that you studied about in pharmacology. The next one that's outlined is Depakote or valproic acid on page 183, and you're going to look for the levels on those. That's the most important thing. And the very last box, it says also to avoid it in pregnancy. And in your bullets on contraindications and precautions, pregnancy category C and D are usual. And then page 184 are medication food interactions with Tegretol. Again, grapefruit juice. On the Depakote, you're going to monitor ammonia levels. You'll also monitor those a lot in mental health and substance abuse units because the chronic alcoholics their liver, is shot. They're going to have cirrhosis, and they test the ammonia levels to see how bad they are. And I was concerned about my liver, and I had my ammonia level checked, and it was normal. But if they have abnormally high ammonia levels, it was real strange at Johnson County Care Center, because the doctor that I worked with, most of the time I was there, never checked an alcoholic's ammonia level. The other one comes along, he checks it, and these people have to take lactulose, which has laxative effects. So one of the young men that was an alcoholic came to us and he was the deaf mute, and telling me he did not want to take that because it made him have diarrhea. He wanted to get across to me that this was causing diarrhea, and he didn't want to take it. And it was hard to explain to him, yes, it's causing diarrhea, but that's what we need to remove the poisons from your body. The liver isn't going to do it anymore. It's shot through drinking, and so we have to depend on the GI system and a laxative like lactulose to get that out, how it acts on the liver and the GI system. The Mectil is the next thing they go over. You have your application exercises that I hope helps bring some of this together. We don't have too many more to go, I don't think. I want to wrap this up as quickly as I can. Medications for psychosis, that is a big one. Maybe they're not as odd, though, with some of these other medications that we've encountered. Maybe a little bit hard, too, to study the medications before you get into the actual diseases. But we will talk about each thing when we go over these again. Schizophrenia is the first psychosis we're going to talk about. If someone has psychotic behavior, and in the common terms, if they go off, they're hard to manage, they're crazy, that's the way most people would call them. Well, they're going to need some kind of antipsychotic medication, of course. So the first class we look at is the conventional or the old-fashioned antipsychotics, and Thorazine is our prototype in here. Haldol is the next one, and I've given Haldol in the hospital I don't know how many times in the past for older people that were agitated or out of, if the anesthetic didn't set well with them post-op or something, if I call the doctor, they would have me give them Haldol, more than likely. Prolixin, we had Prolixin clinics when I was in nursing school. We had community mental health nurses and clinics, so they would have them come, I believe it was once a month, and I got to give scads of IM injections one day at that clinic. Moban, I haven't given as much. Meloril is more commonly heard of. That Loxetine, I haven't given much. Navain, I have a little story to tell you about that. When I was in nursing school, I stayed with a lady, lived with her for a while, and helped her some until she had to go to the nursing home. She was on Navain at night. Well, I didn't have to be with her all the time, and one night I was with a study group, and she got to bed before I gave her bedtime medicines that included Navain. So I thought, I was thinking, and I hadn't taken my pharmacology course yet, or psychology, or psych nursing, so I just thought Navain was to help her sleep since it was at night. Well, the next day I learned how much it helped her with her behavior. She had wild behavior, and I knew to never leave off that Navain. And so with these antipsychotic medications, you may notice immediate problems if they are not taking these medications as they should, or if the CMT went to a break and decided to throw away some medicines or some crazy thing like that can happen in long-term care. The therapeutic uses, of course, for these antipsychotics are listed here. Treatment of acute or chronic psychosis. They could give these in the emergency room. And remember in our movie they talked about, in Capex, they talked about a Thorazine drip. In the City Hospital or the Mental Institute of Manhattan, they might use those. For schizophrenia, for bipolar in the manic phase, for Tourette's syndrome, which we studied in the children's chapter, for delusional and schizoaffective disorder, which is a subtype of schizophrenia, dementia, prevention of nausea, vomiting through blocking of dopamine in the chemoreceptor trigger zone of the medulla. On page 190 and 191, be sure to read over these very carefully. These are the Ames assessments that you're going to look for. Dystonia is the first one that you look for. I actually first heard of that on a medical surgical unit. A new admission was having some seizure type reactions when I gave her Reglan for nausea. And when her physician came to visit her, he said, "You told me you were going to get off that cocaine." And I thought, oh, so this particular medicine, I believe it was Reglan, and she had a cocaine history. And, of course, we didn't know that until the doctor came, and she had a dystonic reaction. So we're wondering, nothing in here about seizures. Why does she have this seizure-type reaction, which was dystonia? And it's the importance of getting the right history out of them and correlating it with physicians and providers that are close to them. They list in here tardive dyskinesia, again, and the involuntary movements, usually of the tongue and face, can also be of the arms, legs, and trunk, so your evaluations include all that. It can go on to neuroleptic malignant syndrome. You know, we do these assessments for the EPS, then you might notice tardive dyskinesia progressing on. Nothing's done about it. It can go on to neuroleptic malignant syndrome, which leads to coma and death. So these people have to be transferred to a medical unit. They have to have cooling measures because a high fever is important. You know, I had a CNA once tell me, well, you're the only one that's always wanting the temperature with vital signs. Vital signs are vital, all of them, in a psych ward, in a post-operative unit, any place. So you need to take all of them, and if the temperature is elevated, you have to contact the provider, of course. On page 191, in the next to the last box there, they talk about sexual dysfunction, and especially males will tell you that they don't want to take their medication because how it makes them feel. Or maybe they will say something like it makes them feel less of a man, and you have to determine from that they're talking about their libido and sexual dysfunction. The side effects can include photosensitivity. On page 192, it goes over a granulocytosis, which I went over in depth with your essential questions, and that's the low white blood cell count that can result from clozaril administration, which is an antipsychotic. Also, these medications can cause prolongation of the QT interval on your EKGs, so that's why you have to get baseline EKGs, and they check those at various intervals. On page 193, we go into the atypical antipsychotics, or these are just the newer ones. They should have fewer side effects, we hope, and that's Risperidol, Zyprexa, Seroquel, Abilify, Geodon, and Clozaril. And Clozaril, we know, can be sort of dangerous. We don't see that as much. And our patient this week in clinical, I believe, that was on a medical surgical unit, was on the Seroquel, and it seems like they're using that for a lot of other things. He told us it was for anxiety, maybe. He wasn't sure why he was put on it. It looks like if you're put on something as strong as an antipsychotic, you ought to know why it is. And then a student told me her mother was put on, I believe it was also Seroquel for depression. So I'm surprised they don't use those other classes of drugs for these problems like sleeping problems or depression, other than these heavy-duty. To me, these antipsychotics are all heavy-duty medications that can have a lot of side effects. I don't have any comments on page 194, but 195, if you want to follow along the book. In Zyprexa, they have that in a tablet oral solution or a short-acting injectable. So you may be called on for that. Seroquel is